was born in Hollywood, California. Met my wife at USC in the last semester of my senior year. Was basically in the automobile business for 35 years.
We've been together for 53 years now. He takes good care of me and I try to take good care of him. Before he had the shoulder pain, he was on the go doing projects, and then bit by bit he would come in earlier from a project. He would stop a project. As it went along, he was having trouble lifting, he was having trouble getting his clothes on.
Trying to sleep on it, it was annoying sometimes, so I would switch shoulders, and it started popping.
So much pain, so much discomfort, so much inability to be him, to do what he wanted to do.
Even driving a car, if I had to turn the steering wheel, I could feel it was uncomfortable. And it was at that point that I said, hey, I need to get this checked out.
In Cecil's case, as in many patients, if they tend to have pain every day, and they tend to have pain that prevents them from participating in things that they enjoy, then it gets to a point where they want to do something. And for me, the criteria for surgery are very practical. I can't sleep, I can't work, I can't do the things I enjoy, or it affects my mood or my lifestyle on a regular basis. And I ask patients those 4 things. And if they start to check off one or more of those, then I think surgery is a very reasonable option.
Dr. Bach, he brought up the x-rays and showed me what the problems were.
So I use the reunion system, and the reason I use that system is that there are a number of studies that show that a lateralized glenosphere with lateral offset gives you a more anatomic center of rotation, and that can translate to increased function or range of motion for patients. That's important because you have to touch the back of your head when you clean yourself. You have to be able to feed yourself. I want my patients to get that active external rotation back. That's a very important part of activities of daily life.
My wife was incredibly helpful during the surgery and the process afterwards. I couldn't have done it without her.
But as the weeks went by and he got a little more mobility, and once he got into physical therapy, and he could see that he could move the arm, and he could see that there was some strength coming back. So I think those were the things I noticed when all of a sudden I woke up one morning and he was out of bed and he was in the backyard watering. And I went, okay, he's coming back. The fact that he can do anything means he likes doing things again. His life is back.
Thank you for this day.